Hi, everyone. I'm Dr. Colleen from Best Friends National Shelter Medicine Team. Thank you all for joining us as we discuss a very exciting topic, parvovirus and panleukopenia in our shelters. If you want, go ahead and pop in the chat where you are from and what you are excited to learn about today. Just a little bit of housekeeping for questions and comments. There's a Q&A box on the bottom of your screen. If you could use that box to ask any questions you have, one of our shelter medicine experts will answer, or your question may be selected to be answered live if it's something that we don't think is covered in the presentation, but is relevant to a large group of people. Use the chat to give experiences, connect with other people, and commiserate with our life in the animal shelter. Parvovirus and panleukopenia remain significant diseases in animal shelters. They can lead to dramatic outbreaks when there are large numbers of young animals present. Not only can these infections spread quickly, but the mortality rate for both diseases can exceed 90% if they're left untreated. Despite their endemic nature, we have new tools and knowledge to combat these diseases. Both parvo and panleuk are similar in many regards. They're both parvoviruses, meaning they are non-enveloped viruses, which can remain in the environment for many months. Our approach to vaccination, sanitation, and outbreak response is nearly identical. They both have high morbidity in vulnerable animals. Diagnosis, treatment, and how we clear these animals differ only slightly. Canine parvovirus and feline panleukopenia share shelter-related risk factors, including overcrowding, insufficient isolation, poor biosecurity and sanitation, and inadequate vaccination. In this presentation, we will discuss strategies to minimize each of these factors. First up is prevention. Vaccination, biosecurity, sanitation, and population management are the keys to preventing these diseases. Vaccination is our core prevention tool. We want to vaccinate on intake or even before intake. And what we mean by this is if you're accepting owner surrenders, can you vaccinate the animal and schedule intake for 7 to 14 days? If animals are coming in as strays, can the person who found the animal foster for 2 to 3 weeks while the animal builds immunity for shelter-related disease? These are just a few ideas of how we can get vaccines into our vulnerable populations before they enter the shelter. Modified live vaccines are currently the best vaccines for parvo and panleukopenia. As new vaccine technologies emerge, use caution before implementing them in a shelter environment. Ensure your vaccines are stored appropriately and double check regularly that your fridges and coolers and everything is operating the way you expect them to, and that they're up to the standards labeled on the vaccine. Medical records are essential. If there is not a record, then it didn't happen. Always schedule your next vaccine via your shelter software to make sure that booster vaccines aren't missed. We will discuss the shelter-specific vaccine protocol next. These are the shelter guidelines for vaccination for both dogs and cats with distemper parvo vaccines for dogs and the combo vaccine for cats. We start at 4 weeks or possibly sooner. We'll talk about that soon. And we redose them every 2 to 3 weeks until they are 18 to 20 weeks old. I determine 20 weeks old as when their adult canine begins to emerge so that everyone is on the same page about what a 20-week-old animal looks like. Adults need a second dose too, so make sure we are scheduling those when those vaccines are given. If there's any uncertainty in records, vaccinate animals as if they've never been vaccinated before. So a question we get often is, why do our shelter animals get so many vaccines? And so this is a graph that depicts the impact of maternal-derived antibodies. The y-axis, the vertical axis, represents the number of antibodies a puppy or kitten has, and the x-axis is time in weeks. The blue line represents maternal-derived antibodies, the immunity puppies and kittens get from their mom through placenta and milk, and the orange line represents antibodies produced by the puppy or kitten in response to a vaccine. Maternal antibodies interfere with vaccination, but only if they're present. They are only present if the mom was vaccinated or exposed to the disease. The rate at which they decline varies by individual, but in all patients, the maternal antibody interference is over by 16 weeks. So we want every pet to have 2 vaccines after this 16-week mark. The black vaccines along the x-axis may reflect the vaccine dosing schedule of a patient at a general practice. Their chance of being exposed to Parvo or Panleuk is controlled, and many times they have an assumption that their mom was vaccinated. The orange vaccines reflect the additional vaccine doses recommended for a pet in the shelter. This is because their likelihood of being exposed to a disease is much higher and less predictable, and we often have less maternal history. This does mean for some patients, they will have 9 doses of vaccine. The number of vaccines doesn't matter. We must handle all patients under 20 weeks of age as if they were vulnerable to catching disease and as if they could develop disease at any time and they might spread it to others. Less than 4 weeks, I have a vaccine here with some question marks. So what about pets less than 4 weeks old? So this is the same graph, but we have removed the blue line, so the maternal-derived antibodies. If mom is not protected, there is no maternal antibody interference and no maternal protection. And so vaccine at day 1 could lead to some immunity. If the risk in your shelter is real, such as an outbreak situation, or if you're frequently seeing Parvo and Panleuk cases, it may be worth considering vaccinating animals younger than 4 weeks, potentially as soon as 1 day old. Here is our canine parvovirus timeline. The panleukopenia timeline looks similar in at most time points. So on day 0, there is direct or indirect exposure to canine parvovirus. 1 to 5 days later, viremia begins. So that is the virus circulating in the blood. On days 4 to 5, shedding of the disease begins. Initial onset of clinical signs can be anywhere from 4 to 14 days. On days 11 through 15, the shedding likely ends. And the most important takeaway from this timeline is animals can be shedding the disease before they show any clinical signs. And so as we move forward to talk about biosecurity, this is why it's so important that we're handling all of these vulnerable animals as if they could be infected currently. When determining the source of parvovirus in your shelter, consider this timeline. If the animal has been in your care for greater than 10 days when they test positive, it is likely that they contracted the disease from your shelter population and they didn't come in with it from the public. So I'm hoping you realize the common theme in all my cute pictures so far, and that is gloves. So gloves should be worn with all pets in the shelter with extra attention paid to vulnerable populations. These are under-vaccinated and under 5 months. As we saw in the last slide, puppies and kittens can be shedding the disease before clinical signs emerge. Treat all puppies and kittens as if they could contract or be shedding Parvo and Panleuk. It's most important for employees working with waste and multiple litters throughout the shelter, not necessarily for the public. So here we have a few of our veterinary externs who are wearing their gowns, gloves, and boots. What about foot baths? These seem like a reasonable approach to preventing spread throughout the shelter. And the answer is probably not. So, when we get to sanitation, we'll see that contact time is one of the most important factors to consider when we're trying to kill parvovirus. So, there's not enough contact time in a foot bath to be effective against parvoviruses. And then the idea may come up, well, what if we just leave the footwear there? But there's a few other concerns as well. Organic debris deactivates all of our disinfectants. At best, it's a false sense of security, and at worst, it is likely a source of contamination for spreading pathogens such as parvovirus around your shelter. For sanitation, so for killing parvovirus, we need to clean up all of the waste that's present. So all of the organic matter needs to be removed from the kennel. And then we want to use a degreaser. So oftentimes this is dilute Dawn, and that can help break up any biofilms where pathogens can be hiding and get to any remaining organic debris. Accelerated hydrogen peroxide is our recommended product. This is often Rescue or Excel. At a 1 to 32 concentration for 10 minutes or a 1 to 16 concentration for 5 minutes. Bleach is also effective against parvoviruses, but it has all of the same downsides as Rescue. You have to remove all of the organic debris. It requires 10 minutes of contact time. So for a 1 to 32 concentration of bleach, that is half a cup of bleach to 1 gallon of water, and you have to use it right away. Question we often get is, what about dishes and bedding? And cleaning and disinfecting dishes in the kennel with the remainder of the kennel and disposal of contaminated bedding and toys is typically the most practical strategy for minimizing parvovirus and panleukopenia moving around your shelter. The other question we get often is, what about foster homes and play yards? And really, I think the focus for foster homes and areas where young, vulnerable animals spend time is prevention. So if we are sending young, vulnerable animals to foster, encouraging fosters to keep them in areas that can be easily disinfected, such as a bathroom or small playpens. And same with play yards. Once play yards are infected, it is very hard to disinfect, and oftentimes long periods of time have to pass before you can use them again safely. So Parvusol. Parvusol is a very unfortunately named product, although I think there may be some intention and marketing behind it. But what about Parvusol? Shouldn't that kill parvo? And the answer is no. Parvusol is what is called a quaternary ammonium compound, and despite having on their label that it kills parvo, studies have found that it does not reliably kill non-enveloped viruses such as parvovirus and panleukopenia. Population management is a crucial component of prevention. So we want to reduce length of stay for all of our pets in our care, but particularly for these young, vulnerable, very adoptable animals. And we want to keep vulnerable animals out of the shelter where they may be exposed to parvovirus and panleuk. Some strategies to do this are allowing the public to interact with young animals safely. And this is essential so that people are interested in adopting them, falling in love with these young animals and taking them home. You may consider using finder foster programs until they have 1 to 2 vaccines, having emergency foster placement on call for neonatal animals, and considering foster to adopt programs as necessary to keep animals that are less than 20 weeks of age out of the shelter. Next, we'll talk about diagnosis, which is a combination of history, clinical signs, and point of care testing. Parvovirus can cause a variety of primary and secondary clinical signs. So some of them are listed on the slide here. Diarrhea is the classic one everyone thinks about. And sometimes it's bloody, but sometimes it's not. So that's what hemorrhagic is referring to, whether there's blood in the diarrhea. Vomiting sometimes canine parvovirus has vomiting, and sometimes it does not. Dehydration, abdominal pain, fever, and low protein and low white blood cells are some primary clinical signs of parvovirus. I want to highlight here that there is a variety of clinical signs, and often the first clinical sign is just a puppy that is quieter than it was yesterday. So being really receptive to some of these more subtle clinical signs will help you catch more cases of canine parvovirus early in infection. Clinical signs of panleukopenia can be very similar to parvovirus. So oftentimes we see diarrhea and occasionally vomiting. There is an array of clinical signs, as you see here on the slide. There's thought to be several different types of panleukopenia, and those are subacute, peracute, acute, and perinatal. Some of the classic perinatal clinical signs are cerebellar hypoplasia, so animals walking with an unsteady, uncoordinated gait. Abortion and stillbirth are also possible. Sometimes the only clinical sign is sudden death in cats in your population. So death in a shelter cat, sudden death, especially if they're under or unvaccinated, should always have panleuk as a differential. And we would encourage you to test these cats if there are cats that are dying in your care. It's important to mention that subclinical infections do also sometimes occur. So just keeping this in mind when you're dealing with potentially an outbreak type situation. Diagnosis. So point of care, fecal enzyme linked immunosorbent assay, or ELISA antigen testing, remains the diagnostic test of choice for canine parvovirus and feline panleukopenia in the shelter setting. So these are your classic SNAP tests. Negative ELISA is where it gets a little tricky. So negative ELISA or SNAP test results in the face of a highly suspicious clinical signs and history. So a young animal that may be under vaccinated or may just be under 5 months should warrant retesting or isolating and treating them as if they have the disease. The SNAP tests are slightly less sensitive in cats. And so these are often the cases where if you're highly suspicious that they have panleuk, but they have a negative parvo SNAP, we often recommend isolating and treatment in those cats just to be careful. The test is highly specific, but sensitivity data is quite variable. There's many different studies out there looking at this, and it can be quite variable, both between dogs and cats and even in dogs and cats. If you're never getting any negative SNAP tests, then I would argue you aren't testing enough animals. What about vaccine interference? We get this question sometimes. So can the vaccine cause a positive test, or can the vaccine, we notice that after we give the vaccine, that's when we see parvo cases. And the vaccine turning into clinical disease, that is not reported in the literature, but vaccine interference is. So occasionally, we will have a positive test that is related to the vaccine, and that can happen for up to 28 days after their vaccination. And this is just pointing out that this is also true for kittens. So what does this mean? What do we do with this information? And the answer is, since we cannot reliably differentiate between false positives and true positives, all positives should be isolated and treated. This should absolutely not be a reason that we're not vaccinating. What about screening? So I just told you that we should be testing more animals if we're never getting any negatives. So who should we be testing? Early diagnosis and treatment will greatly reduce morbidity. But screening of asymptomatic puppies and kittens is not recommended due to the possibility of false positives. And what do we do with all this information? So screening of asymptomatic puppies and kittens is not recommended, but we do recommend testing at the first clinical sign. And for me, this can be a quiet puppy, a puppy that is quieter than it was yesterday, a puppy that, or kitten that didn't eat its breakfast. the first clinical sign can be very subtle. So testing at the first clinical sign. Next, we'll talk about isolation and treatment for both parvo and panleukopenia. So this will include outbreak response, treatment, and clearing of these animals. So isolation versus quarantine. We've all been exposed to these words a lot, especially during COVID-19, and oftentimes they get used interchangeably. So I think it's worth defining these words and identifying when we use them. So isolation is for patients diagnosed with the disease. For Parvo and Panleuk, this is patients that have a positive SNAP test or compatible history, like exposure to the disease with clinical signs. Quarantine is for patients who are exposed to the disease and have a risk of developing the disease. Defining exposure will depend on your individual housing and biosecurity. An example of this is, are gloves reliably used with all pets in the shelter? So if you know that that is not occurring, then defining who is exposed is going to be a much higher number than potentially if you are positive that you have great biosecurity and pathogens can't easily spread throughout patients. When determining risk, so for quarantine, we talked about them having to be exposed and having the risk of developing the disease. We think about whether the patients are over 20 weeks and if they are fully vaccinated. So if the answer to either of those questions is no, then they do have a risk. And so with the combination of those two factors, we can define who we need to quarantine. Here is an example canine parvovirus outbreak response. This looks nearly identical to panleukopenia. So the first step is categorizing those that are infected, exposed, or unexposed. Those that are infected should be isolated and immediately, and treatment should be pursued. For the unexposed, we want to avoid future exposure, and the best way to do this is to get them out of the shelter. This exposed population can be the trickiest to deal with. So we need to categorize the exposed population as low risk, and those animals we should proceed with placement and get them out of the shelter as quickly as possible, moderate risk, or high risk. And so I made some slight adjustments to this flow chart of things to consider. So it is possible that for those exposed with low risk and maybe those exposed with high risk, proceeding with placement and disclosure. Here we have to weigh the risks of continuous exposure in the shelter. And so asking your community if they're willing to help with these outbreak scenarios can be helpful. Also having fosters that are willing to take on some of these exposed animals while we navigate whether they're going to get sick or not can be quite helpful. So those are just some ideas to think about. If this CPV serology is basically titer testing. So if within 24 hours of exposure, so that is really important that it's very early in the clinical course of disease, titers may be helpful in determining risk. So in-house titer kits are available. Sorry, I skipped my slide ahead. In-house titer kits are available for Parvo and Panleuk, and that can help figure out what to do with some of these moderate risk and high risk patients. So outpatient treatment looks very similar for kittens and for puppies. The fundamentals are supportive care and broad spectrum antibiotics. The broad spectrum antibiotics are due to the risk of septicemia and endotoxemia with both of these diseases. So as you see here on the slide, treatment for both of the diseases at our centers looks like fluids, 20 mils per kg up to 3 times a day, Cerenia once a day until they're eating on their own, Convenia once at the beginning of treatment, and we also include probiotics since these patients are often getting antibiotics. Broad spectrum deworming can help resolve other types of parasites that may be contributing to how sick the patients are getting, and diarrhea. Nutrition, and this is really important. So for a lot of these young animals, and particularly kittens, it can be very difficult to keep their blood glucose regulated because they need to eat so frequently. I will say, as a clinical note, I have been very pleasantly surprised at how easy is a relative term, getting a nasogastric tube in some of these patients is. Even these smaller kittens, it's surprising how effective that strategy can be. So getting food into these patients is really important. And then the final thing that's important to mention is heat support. So a lot of times these patients are losing a lot of fluid through diarrhea and vomiting, and offering these patients heat support so that their body temperature stays up is really important. I'd also like to highlight that there are cases that require additional therapies, such as IV fluids and IV antibiotics. If diagnosed early and treatment is initiated early, I think that these cases are rare. But I do think that it's important to mention that outpatient treatment is not necessarily appropriate for every animal that has parvovirus and panleukopenia. So CPMA, canine parvovirus monoclonal antibody, which is a mouthful, is an antibody developed for parvovirus. Other monoclonal antibodies you may be more familiar with are Cytopoint, which we've been using for many years in veterinary medicine. So CPMA can be exceptionally helpful in shelter settings where intensive treatment protocols may not be feasible. In this initial study that's here on the screen, one of the most notable effects of canine parvovirus monoclonal antibody, CPMA, is the difference in the incidence of death in these patients. So these patients in this particular study did not receive any additional treatment. So while that is not our recommendation that patients don't receive any additional treatment, when treatment is limited, CPMA can reduce the incidence of clinical signs and death. And so this may be exceptionally helpful in the shelter setting. Initial reports have also shown a dramatic decrease in the timeline to clear these patients. I wanted to mention that if you are a shelter, a 501c3, I would recommend reaching out to a drug representative and seeing if they are willing to donate any CPMA to animals in your care. Because the cost is often a question that comes up when talking about CPMA. So animals require 0.2 mils per kg of CPMA, and each of the little vials contains 1 mil. The vial is $280, which is about $280 per 5 kilograms of animal. And so that price tag can be out of reach for some shelters, but I do encourage you to reach out to drug representatives and seeing if there's any deals available. And I will say that if you're looking to reduce how long these patients are receiving treatment, this can be one of the most effective strategies. It is recommended that it's given IV, but there are some reports of people giving it subcutaneously in patients that they could not get it IV in. And so maybe earlier the better. And this really has been my clinical experience when people ask me about CPMA and how it's going and how it's being used and what are the results. And my clinical experience is that if you catch the disease early, CPMA is amazing at turning the patients around and shortening the course of disease. If your patient is debilitated, and they're later in the course of disease, say they may have been sick for 5 or 6 days by the time they reach you, I've found CPMA to be less effective in those cases, and I don't think that I necessarily see a difference in patients that got it versus didn't get it. CPMA in kittens. So initially, when this idea started coming up in the shelter world, there was a lot of adversity to it, and I think that's understandable. What we understand about monoclonal antibodies is they're specific for a specific animal, but what has been reported is actually different. So some clinicians are using CPMA in cats. From anecdotal experiences, adverse effects have not been reported, but it's still really unclear whether it's beneficial. If you are using CPMA in kittens, we'd love to hear your experiences in the chat, or reach out to us via our email at the end of this presentation. So clearing these patients. So this is where it is a little different between canine parvovirus and feline panleukopenia. So we'll talk about canine parvovirus first. So once the dog is producing firmer stool, is eating, and no longer vomiting, we run another parvo snap test. If that snap test is negative, we schedule another test to be performed 24 hours later. And if the second test is negative, we bathe the animals, trim their nails, which helps in removing some of the pathogen that may be remaining on the animal. And we move them out to general population or back to their litter or just out of isolation. Then we need to sanitize the kennel they were in, which we went over earlier, but removing all organic debris from the kennel. We make sure that the rescue has been applied for a wet contact time at the appropriate concentration. And we repeat this process when we know that there's animals in the kennel that have infectious disease 3 times. And that's not because the rescue doesn't work the first time, but this helps us make sure that we're not missing any nooks and crannies and that we're really getting the entire kennel sanitized. Panleuk is a little different because panleukopenia can shed intermittently after diagnosis. There's some papers that looked at repeated snap testing and found that it's generally unhelpful. So our recommendation is isolation for 14 days following resolution of clinical signs or 21 days from diagnosis. It is possible that this timeline can be shortened. This is what our protocol is. And so you may find that these timelines are completely unfeasible in your shelter. And if you are one of the more risk tolerant folks, or if you have a stable population of adult cats that these recovered panleukopenia cats can move in with or around, and good biosecurity, this may be shorter than these proposed timelines. So for clearing panleukopenia, the rest looks exactly like canine parvovirus. We bathe them, trim their nails, and we move them out to general population. We follow the same process for sanitizing the kennel, and then that kennel can be reused again after 3 times through the cycle. One thing we do see occasionally at shelters is leaving kennels open after they've had a parvo or panleuk case in them for a certain amount of time. And that is not a helpful practice since panleuk and parvo can live for so long in the environment. Holding the kennel for 5 days or 3 days isn't necessarily a helpful practice. The most important thing is that we are sanitizing the kennel appropriately, and then animals can move right back into the that same kennel. Here is an opportunity to scan with your phone this QR code, and that'll take you to a collection of our shelter medicine protocols. I also wanted to put our email up here, so sheltermedicine@bestfriends.org. You can email us questions, or if you are having concerns about an outbreak, you can use that email really to reach out to anyone on our team, and whoever is available first will get back to you or at least point you in the right direction. And that is the end of my content. So I wanted to see what questions are out there. I can't see any of you right now or the chat box, so I may stop sharing my screen. and see what anyone has. Did we highlight any questions? Oh, there's one open question, so I will answer that really quick. So there's a question that says, when you're using nasogastric tubes, are you placing them for a few days or for every time each feeding? So yeah, nasogastric tubes, in the smallest kittens, I usually use a very small red rubber tube, and I affix them to the head. There's lots of books out there. There's that go over this process. I think there's also a description on VIN on placing nasogastric tubes, but it can be uncomfortable for the animal. So I use a drop of proparacaine before placing the tube, and that can help with reducing the discomfort. Oftentimes the patients that I'm placing these in are quite ill. And so some of the struggles that may exist in a a full strength patient don't exist. But as far as how they're affixed, you can either use a small suture or a staple with a little bit of lidocaine before, and that's my approach. Are there any other questions out there? Oh, I see one additional question actually that didn't make it into the Q&A. And so the question says, you mentioned letting the public interact with puppies less than 20 weeks safely. Can you describe? So yeah, there are a whole spectrum of opinions on this, but what we know is that the public is often not the source of these pathogens if animals are getting them within the shelter. And so the most important thing, the safest thing for these puppies is to get out of the shelter, and same with kittens. And so we have to provide opportunities for the public to interact with puppies and kittens. And what this can look like could be something like hand sanitizer between litters. Despite that not being the recommendation for shelter staff, it may be the appropriate level of protection for puppies and kittens, or providing hand washing stations to have customers wash their hands in between litters of puppies and kittens. Another question popped up. How beneficial are things like 10-day holds on all puppies at intake? As a general rule, we do not recommend any intake quarantines. And this is for the same reason that we need the public to interact with our puppies and kittens, because the safest thing for these animals is to get them into a home safely. And so intake quarantines, really all that they are doing is providing an opportunity for all the other puppies and kittens to be exposed to the disease in the shelter. So we do not recommend intake quarantines for any animals, just your whatever stray hold you may have to abide by. There's another question that says, what is rule for play groups? What age vaccine status do you allow? So I think I personally have, I think, come a long way on this, like over the last couple of years. I think historically, I just wanted the puppies to stay in the safe little bubble and not get sick. So I didn't have to treat the parvo, and it would be fine, and they would be healthy, and they would live happy, healthy lives. But I think what we're learning is that the experiences that animals are having at a young age have such a big impact on their long-term mental well-being and behavior. And so I think coming up with creative solutions for things like playgroup may look like fully vaccinated older dogs potentially having opportunities to interact with the puppies that are under vaccinated, mixing litters of animals less than 20 weeks of age is not recommended, but finding opportunities for animals to play with each other, since we know how beneficial that can be, I do think is really important. Okay. Is there any other questions out there? I will pop our email in the chat just in case anyone didn't grab it off the screen. And I think that's all. Mel and Dr. Becca. Dr. Becca, go ahead. Did you have something to say?
I just saw there was a question coming in here.
Oh, great.
Is
Yeah, we
there
did.
a test to see if the areas is Panleuk free after cleaning? Oh, yeah.
We chatted about this actually a little bit recently, about like, should we be PCRing the environment? Like, is that a helpful exercise? And the answer is probably that it depends, but largely no. So, it will likely give you a false sense of security, right? So if you're like swabbing like a piece of a couch or something, there's no way you could swab the whole couch and know how much is there and things like that. So it is unlikely to be helpful. And so the recommendation is if parvo has been in an area, um, things that are hard and non-porous can be disinfected with rescue the way we described, or bleach at the appropriate concentration and contact time in a foster home. And things that are porous, like couches and rugs and things like that, we just have to assume that there's parvo there and treat it appropriately. So unlikely to be helpful to test the environment. Where can you get the SNAP test? The IDEX SNAP test is our recommended test. There are cheaper alternatives out there, I will admit, but especially for the panleukopenia kittens, I have found that the IDEX SNAP test is the most sensitive. And as far as ordering, I believe you can just order through IDEX. Is that correct, Dr. Becca?
Yes.
Yeah, just through IDEX. And there's fancy SNAP readers and all sorts of things out there, but that's really not necessary. You really can just look at the test yourself.
And also like just go for like some reputable like labs as IDEX, because there are some being sold on Amazon or Walmart or other places as well that you cannot trust, right? Those are not those haven't been like verified, certified that what they are reading is accurate, and can give you also a false sense of a false negative or a false positive that is just going to be a waste of money and a life in some cases. So there was another one. I think Abby answered the other one. Yeah.
Yeah. And then there's one question where you can watch it again. So if you're registered for the webinar, you can get a recording after. I'm not sure how long after it'll come to you, but it'll come to the email you registered under. The in-house titer test, VacciCheck is that the one? Yeah, VacciCheck is the one we usually recommend. And it's a subjective test where the color changes and you're interpreting the color compared to a control. And so there is a little bit of subjectivity in reading the test and takes a little bit of practice. But the instructions are very thorough, and it's usually pretty obvious when they're on dramatic ends of the spectrum. Sometimes in the middle, it gets a little difficult to interpret, and then I would recommend erring on the side of caution for those patients.
Definitely. And titer test as well for that. You have the VacciCheck and you have the other one. There are two, I forgot the name. But definitely it's for cats you have as well. It's been like we looked not a long time ago, and it was hard to order. So for dogs, for sure, it's super easy to find. For cats, it's like it was challenging in the past months. I don't know why.
Yeah, I've seen VacciCheck has one for panleukopenia, but I'm not sure about availability yet.
Yeah.
Okay, I think we answered all of the questions. For Best Friends staff, we have a Q&A following this session. And for everyone else, Mel highlight that you'll get an email with a link to the webinar in a couple of days. And then you can rewatch it or share with your friends. Thanks, everyone.